Hi, everybody. Dr. Daniel. And today I'm talking about CGRP drugs for migraine prevention 2024. Well, the American Headache Society, AHS, recommended in March 24th, 2024, that the 6 CGRP drugs be considered as first-line migraine treatment for prevention. And this hadn't been done before. The last statement on this had suggested using the older preventive drugs like Inderal, Depakote, and things like that. So this is really a change in advice. Well, what about migraine? What is it? Migraine is a common, often lifelong neurologic problem occurring in 26% of women and 6% of men. Migraine symptoms are severe, often one-sided headache, sensitivity to light, sound, and odors, nausea and vomiting, and the need to be down. The duration of a migraine headache may be 4 to 72 hours, and the patient may be incapacitated or disabled during that time. And the frequency is often once or twice per month, and the headaches start in late teens and taper off by age 60 or 70. What is the migraine process? Well, the migraine process, the first step of that is the trigeminal nerve activates. Then in 20 to 40 minutes, the ganglia of the trigeminal nerve and the artery start to release the neuroinflammatory chemicals, CGRP, neurokinin A, and substance P. And CGRP has been found to be one of the major inflammatory problems with migraine. Now, these neurochemicals inflame the nerve, the artery, and the human pain center, which is the thalamus, and then they start arterial vasodilatation. These new CGRP antibodies block the release of CGRP, one of the central neurochemicals involved. What is the AHS statement? I'm going to read it in quotes. The American Headache Society calls for CGRP targeting therapies to be considered as a first-line approach for migraine prevention without a requirement for prior failure of other older classes of migraine preventive treatment, period, end of quotes. What's the goal of preventive treatment? Well, the goal is to reduce the frequency, intensity, duration, and disability associated with migraine attacks. AHS states that preventive therapy is indicated for approximately 40% of people with migraine. The CGRP drugs are the monoclonal antibodies, fremanezumab, glanazumab, erinibab, and eptinezumab, and the small molecule CGRP receptor antagonist, megenopent and adocipent. What's the HS review results? Well, they found evidence supporting the efficacy, tolerability, and safety of CGRP targeting therapies for migraine prevention to be substantial in its volume, scope, and quality. The AHS president, Andrew Charles, MD, fellow American Headache Society, made a statement, quote, "Moving CGRP targeting therapies to the first line of treatment could have transformational impact on the prevention of migraine attacks and their associated burdens. Elevating CGRP targeting therapies to the first line treatment should reduce barriers for patients to receive these effective treatments and bring hope to countless people who experience is invisible yet disabling disease, period." I also hope it can have impact on insurance companies so they'll make this available to people on a first-line basis, because previously they made you fail a couple of the older drugs. So this is good news. I hope it's helpful to all you folks out there who have migraine. Please click like and subscribe down there, and I'll see you again on the next talk.